Hi guys, so Matt Hancock, the Health Secretary, spoke to Sky News about the current situation and the plan surrounding the pandemic. So let's hear what he had to say.
I want to talk to you now, Health Secretary, about the next steps to easing the lockdown. Can you confirm that from July the 4th, if the infection rate allows, we'll be able to go on holiday in the UK or get a haircut?
Well, we have a clear plan for how we get out of the worst parts of this lockdown safely, and I stress that word safely, it's absolutely critical. We're working through that plan. The plan is so far and currently working. We can...
What is this plan? Can you tell us what the plan is? Matt, you know, it's like a kid saying, have you done your homework? Have I done my homework? What is homework? Homework is what I have to do when I'm at home, after school. Am I doing homework? I'm working through the homework. Have I done it? That is a question that we may answer in the future.
See the total number of new transmissions coming down. Thankfully, the number of people dying from coronavirus is coming down. The number of people on ventilated beds in hospital is coming down. And so on Friday, the scientists were able to advise that the alert level came down. So we are on plan.
Scientists said that the alert level could come down. Can you present that to us? Can we see that evidence that the scientists said that the alert level can be reduced? You know, the politicians said it could be reduced. We didn't hear the scientists saying this. You know, it sounds more like hearsay. Of course, you're not publishing the scientific evidence, the actual data, the actual reports from SAGE. So it's very difficult for people to accept that the alert level should be reduced when the politicians are saying it and using hearsay as evidence to what the scientists are actually saying.
We'll of course be setting out more details of that plan, and in the plan it states that on around July the 4th we will take further measures if it's safe to do so.
So around the 4th of July, you may take more measures if it's safe to do so. That is the plan.
And what could those further measures be? I'm asking because there's speculation, obviously, in the papers today that we're talking about UK staycations, we're talking about hairdressers, pubs. What could the next steps be?
Well, we talk about hospitality and outdoor hospitality in that plan, but there are a whole series of other services, especially those where you need to be physically close to somebody in order to carry it out, like a haircut. A lot of the country does need a haircut, and we need to do...
What the hell is he talking about here? He was asked a specific question, and now he wants to talk about other things.
That in a safe way. And so it's both about what safely can be reopened, but also how we do that in a way that minimises the rate of transmission. The way we think about it is this: how can we get the best possible positive impact?
She asked the question when, and you're not responding to the question when. You're talking about if and possibly, and you're describing how it could happen. But you're not responding to the question of when.
Impact for people's lives and people's livelihoods, for the economy, subject to always keeping it safe, and the safety has to come first. You know, nobody wants to see the number of cases increase, and instead what we want to do is use local action to target clusters and outbreaks when we see them.
Just to be really specific then, because as you say, lots of people do need a haircut at this point. Could we be going to the hairdressers on July the 4th?
Well, I'm not going to rule that out. I'm not going to rule that out, but we'll set out the details as soon as we can.
I thought you had a plan, Matt. You said we have a plan, and now you're talking about we'll set out the details as soon as we can. So are you making up the plan as you go along? Like, you could say, we're going to set it as the 4th of July. That's when people can return, but if necessary, we may need to extend it. That's, I think, an acceptable response. But he's not responding in that way. He's talking about, well, this is what you need to do, and this is what we have to consider, and just give a clear answer. This is what we want. Yes, on the 4th of July, you can go and have a haircut. But between now and the 4th of July, if something changes, we will need to change that date. I don't think anyone would complain. People may not be happy about that. But if you are clear with them and say to them, look, this is our objective. This is our objective, the 4th of July, that you can go and have a haircut. But if the situation changes between now and the 4th of July, we have to be dynamic and we have to monitor the situation and change the rules if necessary. But he's not doing that. He's not saying that.
And what I'm trying to do is set out the principles behind the decisions that we'll take, and we'll set them out in a rigorous and formal way. But you can see the direction that we're going, because we set the direction out in the plan that we published last month, and we are clear.
The plan that you were talking about last month, the one that didn't make any sense.
Really on track for that plan, because the number of cases is coming down, and the plan does refer to hospitality and some of the other things that are closed that so many people want to see open.
But you're talking as if you never read the plan, as if it was somebody told you, Boris Johnson told you, we have a plan, and you didn't actually hear what the plan was, and then you were sent out in front of the camera to talk about the plan. And you didn't actually, you have to defend it, but even though you don't know what the hell is in it, what's in it.
One thing, of course, that lots of people want to see reopen is pubs, but the drinking experience could be a bit different. There's talk about potentially ordering through an app or having to register before you go to your local pub. What kind of things could we see?
Well, that is the sort of thing that we're looking at for how do you make it safe to open things, and more importantly, as safe as possible to open as much as reasonably possible. And that's the approach that we're taking. It's actually the approach that many other countries around the world are taking. And things like wearing a face mask, which reduces the transmission very clearly. About how the seating is arranged, because face-to-face is much more...
Why is he incapable of responding to a question? She said, is there an app or is there something like this? And now he's talking about masks. Could he not say, yes, there is an app, or no, there isn't an app? To clarify, why is there always this confusion? We pump as much confusion into the response as possible. She asked about a date. He wouldn't give her a date. She asked him about an app. He won't give her an answer about an app. He's talking about masks now. Something that I was talking about weeks ago. Almost a month ago, I was talking about why the hell is there not a rule for masks in the UK? And now he's talking about masks and the merits of masks. A couple of weeks ago, they were talking about, well, nobody needs to wear a mask. And now he's saying that people need to wear masks when the question was about an app. I can understand why people are confused and why people are not respecting the rules. How can anyone respect the rules when the health secretary is not being clear about the rules?
More dangerous than back-to-back, and there's more transmission than side-to-side. And also the sorts of things that you can put in place, as you mentioned, to strengthen test and trace, because the whole approach is to move as much as is safely possible from a national lockdown towards targeted local action where we see an outbreak. For instance, this...
But she talked about an app, about buying a pint of beer. Now you're talking about test and trace. Why are you going off on a tangent here?
So just specifically, you could have to register effectively, sign up before you go to a pub?
Well, I wouldn't rule that out. It isn't a decision that we've taken yet, but there are other...
I haven't ruled it out. Really, this is unbelievable. If Ian Duncan Smith was saying this as a backbencher, you could understand it. This is the Health Secretary, Matt Hancock, saying we haven't ruled it out. This is something you should be implementing now. He's treating it as if it's something that's going to happen next year. Well, we haven't ruled out the idea of having an app next year. But this is something you should be dealing with at the moment.
Countries in the world that take that approach, and there's a reason for it. And the reason that they do that is that you can then, if there is a positive case, and now there's only a few thousand positive cases a day rather than the many tens of thousands that there were in the peak, then you can go and trace the people who were at risk of being in contact. That's the approach.
But she's not talking about that, Matt. She's talking about an app in order to go to the pub, an app in order to order a pint of beer. She's not talking about testing and tracing. You're talking about something completely different. Maybe he didn't hear the question, but I don't think that's the problem here.
Approach that's working through the test and trace process, and it's an approach that's being used in other countries as well.
Of course, it's a really difficult time for the economy, even if things are starting to gradually reopen. Revenues apparently down around 40% of normal levels in shops. Is the Chancellor considering a cut to VAT?
Well, that is absolutely a matter for a budget, and you wouldn't expect me to comment either way on any speculation on what's in a budget. It's very much a matter for the Chancellor, and it's very much a matter for a budget.
Okay.
But the broader point's true, right? Which is that the economy has taken a terrible hit.
Matt, you should just stop there, okay? Just say, look, this is not my field. This is the job of the Chancellor, and stop at that.
And we need to get it back on its feet and give people the confidence to get out there, and we can see that things are improving. We can see the virus is increasingly under control. There is more work to do, and we must keep it down now that we've got it down. But we must also have the confidence to restore as much of normal life as is safely possible. That is the normal things people want to go back to. For instance, being able to shop.
Okay, but what's that got to do with VAT? You said I can't comment on this, and then you go on and comment about it.
The key thing, of course, if you do want people to shop, to spend money, to help get the economy moving again, is to convince people, as you say, that it's safe to do so. And a big part of that is having the contact tracing system up and running. So as soon as new outbreaks of infection are identified, they can be clamped down on quickly. And I just want to have a little look about whether the system is working as it should. Because in the latest week, for what we have stats for, 4,300 people who tested positive for COVID-19 were reached by the test and trace system and asked to provide details of their contacts. So that's 4,300 contacted every week. But the ONS estimates that 4,500 people get coronavirus every day. Why are so many people not being reached?
Well, the number one thing that we need people to do is, if you have symptoms, come forward for a test, because that ONS survey...
But you're not answering her question. She said a certain number are being tested per week, and a certain number are getting the virus every day. And you're talking about, well, if people get infected, they need to come forward. Why are you not responding to the question?
Which is the best survey that there is of the extent of coronavirus, also finds that between 70 and 80% of people, so around 3/4, don't have any symptoms at all. So they don't know to come forward for a test because they don't have symptoms. And that is at the heart of the challenge of this virus. It's a natural thing of this virus that makes it so difficult to control that many people who have no symptoms at all have the virus.
But that's not the question that she asked. She was talking about people who were tested and people who have the virus.
And can transmit the virus.
Sorry, not even people who were tested, people who were traced and people who had the virus. That's not, you're talking about something completely different again, Matt.
Virus. So that's the main reason. Now, of course, the stronger the test and trace system gets, the more of those people are reached because they've got it from somebody, and the more people who are tested positive out of the total number of people who get coronavirus, the better we will get at being able to control it. So this is why it's so important that if you are asked to isolate by NHS Test and Trace, then you must do so, because that then breaks the chain of transmission.
But he's just explaining how it works. He's not explaining why the number of people who get tested and the people who are actually traced are completely different. Why aren't you responding to the question? You could respond by saying something, even deflect it in a way. It's saying, look, at the moment it's having some problems. We're working through it. We're trying to get as many people out to do these tests and to trace these people as possible. You could say something like that, and I think it would be acceptable. You know, it's having some problems, but we're working through it. We're doing the best we can. We don't have everyone up to speed on the training. We don't have all the tracers out at the moment. We're trying to get as many of them as possible out to the public to trace them. You could say something like this, and I think most people would accept that. But you're talking once again about something completely unrelated to the actual point that the Sky News interviewer is asking you.
And at the same time, we go in with local action in places where there's a cluster. And we've talked about some of that this week. For instance, there's been a couple of manufacturing facilities in Kirklees in Yorkshire, and we're working in Leicester, where we've got a challenge, working very closely with the local council, the local director of public health.
At the same time, from your answer, it seems pretty clear that finding the contacts of these people is absolutely critical to the system working. But a subcommittee of SAGE, the scientists advising the government, said back in April, a successful contact tracing strategy would require around 30 contacts to be tested per symptomatic case. Beyond that, the benefits would be marginal. But the latest figures suggest just 10 contacts are being identified by positive case. Why is that happening?
Yeah, so the difference between those figures is because of lockdown. So for those people who test positive, who are in jobs that require them to go out and work in a normal way, we're seeing around 30 contacts per person. But a lot of people are in lockdown, and they tend to only have 3 or 4 contacts themselves. So that advice was based on analysis when there isn't a lockdown. When there is a lockdown, the number of contacts people have comes right down.
It was the 20th of April, so it was during the lockdown.
I know, but I know that paper, and it's based on analysis of what happens during when there isn't a lockdown. And the point I'm making is that part of the purpose of lockdown was to reduce the number of contacts that people have, and that has happened. And so and so there are fewer contacts to trace of the people who've tested positive, and that's a good thing because it means that the virus has had less chance to spread onto other people.
I don't understand what he's saying here. Really, I don't understand. I'm confused to the substance of what he's actually saying here.
People. And I'm just delighted with the early performance of NHS Test and Trace. It has performed really well. The vast majority of people are engaged with it. The vast majority of people are isolating, say that they'll isolate when they're asked to. And this is, there are now over 85,000 people who are isolating because of this system being in place.
Stop calling it NHS Test and Trace. It's not carried out by the NHS. It's carried out by a private company. He keeps calling it NHS Test and Trace, but it's actually a private company that carry out this test and trace. But he's linking it to the NHS in a way to give it legitimacy.
And so we're targeting the need to isolate at those who are higher risk, meaning everybody else can have some of their freedoms back. So it is exactly how the system is intended to work.
But if these people are asymptomatic, how do you know that they're not infected?
Say you're delighted with it is exactly how it should work, even though it's catching less than 1 in 7 people with coronavirus. Now, you hired 27,000 contact tracers. In a week, they reached 40,000 contacts. So they're reaching less than 2 people in a whole week. Yeah. How is that a success?
So let me just pick you up on both of those points. So the first one, I've just answered this point, that there are many people are asymptomatic, and
I understand the explanation. I understand that you're giving the explanation. I understand that you're giving the explanation for it, but it's still, as you say, it's clearly asymptomatic people are slipping through. How can it be right that the contact tracers are contacting less than 2 each in a whole week?
Well, we've got a really big system in case we need it and on standby. And so this is the second point I was going to come on.
How is that related to the number of people that are being traced? She said about 2 people are being traced per week. And you're talking about, well, it's a big system. How is that relevant to the question that she asked?
Having explained the point on your of why it's hard to find all of those asymptomatic cases and why anybody with symptoms must come forward. The second point is we built a big system and we don't need as big a system now because the number of new transmissions is lower than it was, and that is a good thing. But
this is just a word salad. I really don't understand what he's saying here. Now, maybe I'm incompetent. I don't understand because I'm thick. But I really don't understand what he's saying here. He's mixing up different things. He's talking about asymptomatic. He's talking about test and trace. He's talking about people who are not getting infected. He's talking about 100 different things, and I'm confused. Now, if I'm confused, I imagine people who are not following this are even more confused.
Am I pleased that we've got excess capacity in contact tracing? You bet I am. And I read these stories in the newspapers saying, you know, oh, it's terrible, we've got contact tracers who don't have enough to do. Well, it is a good thing to have spare capacity in these sorts of areas. The contact tracers are doing...
Some of the contact tracers have said that they haven't received sufficient training. Some have said that they attempted to do training and the websites that they were actually advised to do training on were not working. Others have said that they've been sitting around waiting for work to receive work and they haven't received it. Now, this would be understandable if there were no cases, but there are hundreds of new cases every day in the UK. There was 150 or 160 or 140 deaths yesterday. So the situation is not under control, or not under sufficient control. But Matt Hancock is talking as if, look, the coronavirus is over. These people are sitting around waiting for work, and that's a good thing, because there's nothing for them to do.
Doing a brilliant job. And as the number of new cases comes down across the country, so there will be less contact tracing to do. At the same time, we want to increase the number of people who, out of the actual total number of new transmissions, we want to increase the proportion who we find. And so...
And how do you plan on doing that?
That is why we have the capacity there. And having spare capacity in a project like this is a good thing.
Okay. Now, you said that part of the contact tracing system would be an app that would be crucial to all of this and would be launched by mid-May. But after 3 months and millions of pounds, you've had to abandon the original app because it only recognised 4% of Apple phones. Now, when you launched the trial in the Isle of Wight, you said, where the Isle of Wight goes, Britain follows. With hindsight, would it have been useful to know that where the Isle of Wight was going was actually down a dead end with an app that didn't work?
No. On the contrary, we will...
No, on the contrary, we failed. We made a complete and utter shambles of the situation. But now I'm going to explain why the utter shambles is not a shambles.
We'll get the app up and running, there were two different types of technology, and we know that the app that we used on the Isle of Wight, that works on Android phones. Apple have a part of their system that meant that it wouldn't work on their phones, and we were engaged with Apple to talk about how we could fix that problem. They, at the same time, later brought out their own version with Google.
So why you were talking? So you're saying here that you were working with Apple. So the app wouldn't work on an Apple phone, and then you were working with Apple to. Why didn't you ask them? Why didn't you work with them before releasing the app to test? Okay, Apple, will this app work on your phone before we release it? It seems to be just a complete and utter. Let's try this. Doesn't work. Okay, let's try something else. There's no plan, Matt. You keep talking about a plan. It seems to be a plan that's written on the back of a napkin. There isn't a plan. We make it up as we go along.
As soon as they announced that, we started working on that project as well. And now we are bringing the two together because there's problems with their app in terms of how it measures distance. There were clearly problems with ours because there was a bit of it worked on Android, and Apple wouldn't make the change that was needed to allow it to work on Apple. So we're engaged with them and with Google to have a system that works and gets the best from both sides. But I'm really...
Why did you try to develop your own app? Why didn't you outsource it to Apple and Google? Like, I don't know all the details here. I don't know the full story here. But it seems to me that Apple and Google said at the beginning, look, we are available if you want to develop an app for this crisis. And you said, no, we want to develop our own one. And then it didn't work. You spent tens of millions of pounds on it. Now, where did that money go? Who received the money for the development of that app? I think it would be important to know. Is it a Tory donor? Is it someone who set up a company just to create an app that didn't work but would receive government and taxpayer money for it? Why didn't you go directly to Apple and Google from the beginning and say, look, we need an app?
On that, I'm really glad that we went down both routes. As I said on Thursday, that we rode both horses.
So we spent money on something that didn't work, and then we spent money on something that did work. And that's a good idea. Please tell me any other project where spending money on something that works and spending money on something that doesn't work is a good idea.
Because it means that we can now bring together the best of both. Of course, I wish we'd brought it in sooner, because I wish that we'd been able to, Apple had made the change that was needed for it to work on Apple phones in the same way that the original works on Android phones. But
now he's blaming Apple. Now, I don't know if there is a legitimate reason to blame Apple, but it seems interesting that the health secretary is blaming Apple for something that he decided not to include them in, and then discovering after that it doesn't work. Like, if you want to produce an app that works on Apple phones, and you are the British government, I think it would be important to include Apple at the beginning, not to include them later on when you discover that the app doesn't actually work.
But we will get there.
I mean, I can see the kind of the frustration, if you like, that Apple didn't make the change that you feel that they could have. And, I accept, perhaps Apple weren't as helpful as you would have liked them to be. But what I don't understand is why this wasn't picked up earlier. I mean, it only recognised 4% of Apple phones. I mean, this isn't like a marginal difference. This is a huge number. And on the 10th of May, for example, Dr. Michael Veal told...
You can see Matt's body language is like, okay, I know we messed up, but please stop reinforcing the idea that we messed up.
this show. The problem is that Apple and Google, Apple in particular, have said that the app doesn't work with their operating system, and so the UK is really going against the grain, and therefore it's finding problems on both Google and Apple phones. He says he first warned the government about this on the 11th of April, so I just don't understand. Why didn't you just listen?
So Matt had tried to throw... There was a big red bus that passed behind Matt just as we said this. Matt tried to... he tried to throw Apple under a big red bus, but Apple said, no, you're not going to throw us under a bus. We told you about this before.
Listen to them. Why didn't you admit defeat earlier?
Yeah, I've seen this point being made, and there's a really simple answer to it, which is the moment that Apple and Google brought forward their technology, we started working on that as well.
So when we discovered it was an absolute failure that we did, and Apple and Google said, look, we have a solution, we started using that solution. This is just insanity. It's like my car wouldn't work, but when the mechanic came and repaired the car, my car worked. There, and I started using the car again. See? There we go. What's the problem?
So, absolutely, it's a perfectly reasonable point that people make, which is that Apple have in the past also been intransigent in the face of perfectly reasonable requests from democratically elected governments to work with them on solving particular problems, whether that's about solutions to terrorism or other technical problems. And so...
No, you're not going to throw... Look, I'm no fan of Apple, but you're not going to throw Apple under a bus because of a decision you took. You decided to go it alone. You decided to exclude Apple here. And your app didn't work. You were trying to force it to work on a system that rejected it. And then you blamed Apple for it. Now you're trying to muddy the waters by saying, well, Apple has some issues regarding security and, there were phones that we wanted to be able to access, but they were blocked or encrypted because of Apple's system, and we wanted to be able to access them for security reasons or whatever. That's a completely separate issue. You're attempting to blame Apple for a mistake that you made. And Apple had actually pointed out the mistake back in April, but you ignored it. And now you're trying once again to throw Apple under the bus. It's disgusting, so it is. Once again, I'm not a fan of Apple, but Apple is not to blame here. You are to blame.
Absolutely, I understand that reluctance on their part, and to be fair to Apple, they may have good technical reasons for it because which are under the skin of things. As soon as they brought forward their technology, we immediately started working on that.
And now he's trying to claw back. Whoops, I said perhaps too much. But once we started to work with Apple, they were willing to work with us. He's attempting to claw back some of the blame. Okay, I've gone too far. I shouldn't have actually blamed Apple because Apple actually did help us out in the end. But he's trying to cover his arse again. He's trying to cover the Tories' arse. He's trying to cover the government's arse, Boris Johnson's arse. And it's disgusting.
And so that's why I say we rode both horses. And that's why I'm highly confident that we will be able to get there. And we're working on that right now.
Just very quickly, when are you expecting the app to be ready?
Well, I'm not going to put a date on it. And the simple reason is that...
I thought you had a plan, Matt. Surely if you have a plan, the date for the app is in the plan. If you had to say, well, we need to develop an app, and this plan, we're just working on the plan at the moment, and we're going to put the app sometime into the plan, then I could accept that. But you have been talking about this plan for weeks now. And now you're saying, well, we don't want to give away too much information about where we're going to put the app in the plan. Then it's not part of the plan.
We don't have a launch date, and until we do, I'm just going to work hard to get it as soon as possible.
But it will happen.
Well, I'm highly confident it'll happen.
That means no. It will happen. He could have said, yes, it will happen. I'm highly confident it will happen. This is all about protecting the party, protecting Boris Johnson, protecting Matt Hancock, protecting whoever else is involved. Because they're afraid later on there will be a public inquiry. And they will be pulled in front of this inquiry and asked to explain the decisions they made, the mistakes they made, the decisions they did not make, and how thousands of people died because of those decisions. And this issue of the app is going to be asked. And Matt Hancock is being very careful now because he's saying, I'm working towards it. I'm trying my best. He's not giving a date. He's not giving a deadline. Because if he did, then when that deadline arrives and he has failed, he would be answerable for it. But he wants to avoid that scenario.
But, given my experience over the last 3 or 4 months on this one, I'm not going to put a date on it. We're just working incredibly hard to make it happen.
OK, and just very finally, looking back at the last few months, the government's record on dealing with the pandemic, the UK's got the highest death toll in Europe. The OECD says that we will suffer the largest economic hit of any major economy this year. We're behind many of our neighbours on easing lockdown. How can it be that we look like we're going to end up with a higher death toll, a longer lockdown and a worse economic hit? How has that happened?
Well, there'll be a time for this sort of analysis, and it's very important in terms of ensuring that all the lessons are learned. And there's lots of potential reasons for that, including just how open a country we are and the amount of engagement that we have around the world.
What? What are you talking about, Matt? How is that relevant? You made mistakes. You made bad choices. You ignored the problem at the beginning, and then you attempted to ignore it also during the problem. Then when it got to a stage where you could no longer ignore it, you tried a whack-a-mole solution. Let's throw something at this wall and see if it sticks. No, it doesn't stick. Let's throw something at this wall and see if it sticks. No, it doesn't stick. Let's just keep trying different approaches instead of actually having a proper plan in place that you actually did have. There were mechanisms in place to deal with the pandemic, but you decided not to fund them, and you decided to ignore them as well. The issues of PPE, the issues of track and trace, the issues of a lockdown. Everything was about, let's try something softly. Let's not treat it with the respect it requires, and hopefully muddle through. This would be something understandable within a third world country, but not the United Kingdom. And sadly, tens of thousands of people have died because of your decisions. Those people are not coming back. Those people are gone. Their loved ones have lost their loved ones. And you have blood on your hands. The decisions you and your leader Boris Johnson made have costed countless lives. And no matter how you try to spin it, you're not going to be able to get away from that. I truly hope that when this crisis has passed, there is a public inquiry. I'm pretty sure there will be. And I hope that you answer for the decisions that you made and for the decisions that you didn't make. Let me know in the comments, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot. Why not become a Patreon and enjoy access to our Discord server where we share news, chat, and have some fun. If you become a patron, you can also make video suggestions on topics that are important to you. Check it out via the link in the description.